With the holidays here, it can bring on stress to the heart. And joining me is two-time Emmy Award-winning Dr. Rizik, who is a major staple in the health world. Talk about signs and ways to avoid stress on the heart and head into 2026 healthier. Hello, doctor. How are you?
Wow, it's great to be back.
It's so good to have you here. I mean, wow. Let's just, before we go any further, I said two-time award-winning, Emmy Award winner for the procedure that we had here on our station.
We were together for that.
I was a doctor, and I think we have a little bit of footage here of us in the operating room, and this is exactly what you do best at, and that is helping people live longer. And so, what was this one we were doing?
This was a mitral valve procedure that we did several years ago, and this is a patient who had no options, was told he had no therapy options, that he needed to go to hospice. And if you remember, we got to know him, you interviewed him, and then we did the procedure, we repaired his mitral valve, and a week later, he was here in the studio with you.
It was amazing. And the thing is that we did two of these, and I didn't know that people were actually awake until I had to have the procedure done on me. And your team was amazing. I had a blood clot that broke off that went to my heart, and I was very lucky to know what was going on.
You had some great doctors who were vigilant and moved you through the system, and then you came to me, but those doctors were very vigilant and did a spectacular job.
And that's why we want people to understand about heart disease and, of course, the stress the heart gets during the holiday season. People kind of like think about, the mental state, that's one thing, but you have some tips and some ways that you want to make sure people are watching and being healthy.
It's really remarkable how wonderful the holidays are and how potentially concerning the holidays are, or can be. For instance, this is a time when we indulge in food. Studies have shown, lots of parties to go to and whatnot, and studies have shown that throughout the 12 months of the year, the 4 weeks between Thanksgiving and Christmas or New Year, that's where most of the weight gain comes. So some of this overindulgence, while it's great to get together with family and nothing better than to sit down across from family and friends and break bread, we have to be careful about overindulging, and weight gain is really a concern during that time of year.
Yeah.
Alcohol consumption. There's nothing great than having a glass of wine with a friend or family. It's really a fantastic feeling. But we have to be careful about overconsumption of alcohol. Obviously, some concerns about that. But then getting behind the wheel of a car. This is when a lot of individuals get in trouble behind the wheel of a car. So we have to be careful about alcohol consumption. Yeah. And then there's the whole mental health aspects of the holidays. And specifically, the holidays are a great time for family and friends to reconnect, and that's the great part about the holidays. But many people who maybe aren't around family, have lost their loved ones, don't have friends, really out here in Arizona where so many people have moved from somewhere else, they may be alone and feel isolated during the holidays. So those are some of the things that we have to think about, the upside downside of the holidays. And then finally, safety around the house. We're putting up Christmas lights, we're climbing on the roof. You said in the green room before we came on, you're always concerned about seeing people up on the roof putting up their Christmas lights and falling off the roof, or we're cooking all the time. Yeah. Fires in the kitchen. This is a time of year where we see a lot of that.
Yeah, and we got to watch for that. Very important. Really quick, we want to talk very, very quickly, women and heart attacks. A lot of people don't think about that, do they? Especially this time of year, that more women are having heart attacks than they are being diagnosed with cancer.
I think you enlightened the Arizona community about that with one of the segments we did several years ago. We interviewed some young women, and then we demonstrated, when you came live into the operating room, we actually did an operation on a 50-year-old woman with heart disease. Women do develop heart disease. The timing of when women and men sort of peak with development of heart disease is different, but women develop heart disease, and one of the concerns is that women sometimes get diagnosed and treated later than men. So that's one of those vigilance things that we as physicians, and it's not just women, physicians should recognize this. Men and women in our profession need to recognize that.
I wish we had more time to talk with you, and I know you can come back, and I want you to come back because you are at a new home with Banner Health now. It's a great facility, so you got to come back, or maybe I'll come over and visit you there. How's that?
I think what we have you do is come to Banner Health. Our veteran Scottsdale group is now at Banner University and Banner Health. We're in Scottsdale. We have a beautiful, beautiful practice there, and I think what we do is invite you to come to our Banner facility in Scottsdale on Dobson Road, and then maybe you and I do a reprise of our procedure in the cardiac catheterization lab. What do you think?
I love it. Thank you. Hey, doctor, I think it's going to be fun. Thank you for joining us.
Thank you.
There you go. You want more information about, of course, heart health and Banner Health? You can head over to the CW7AZ.com.